Hey Maggie. Hi
Hi,
Haley.
Christy. Haley.
Welcome back. We're very excited to have Dr. Hayley Stulmaker with us again to talk about working with parents of kiddos who are anxious and some advice or guidance that she might have for us. So welcome.
Thank you. I'm glad to be here.
Yes, you gave us so much great information last week. I'm really excited about talking with you today. And I'm really curious about this part, working with parents and speaking to parents. Because sometimes, and I think our listeners have shared with us, parents can be challenging.
Mhm.
And they may be the more challenging part of the relationship for some of our listeners. Um, Not because they're mean and scary, right? But it's sometimes, I think, more of the demand or even the parents' own anxiety that's coming in into the relationship of getting their kids services. So, um, yeah, I'm really excited.
Yeah, no, I mean, and I agree, Christy. I think that this is one of the biggest challenges that my supervisees face is figuring out how to work with parents and how to be effective in that. So I think that they can build relationships and use their counseling skills that they already have. But I think that it does get kind of tricky to know, okay, this is what's happening in play therapy, and how do I take that and make it meaningful for the parents so that the parents then can walk away and feel like they've received something beneficial and that they're moving towards something. So I think that it's hard, when they're getting their training, they have like maybe 3 hours worth of time focused on how to work with parents out of, all of their training. And so I think it makes sense that this feels like a weak area, and it's hard. It's different than being in the room, which is hard enough. Right? So,
Right. And sometimes it's right after you've come out of the room. So you're already
mhm.
worked really hard, and now you get to work harder with or continue your work with parents.
Yeah,
I
work
don't want to
differently.
make it sound like parents are the worst thing in the world because I think they're so much fun to work with. So,
Yes.
um, yeah.
And I think once you kind of figure out ways to do it, like in some ways, I enjoy that more than
Mhm.
working with a child. Like when I'm in with the child, I'm loving it. And then I come out and I'm like, ooh, now I get to figure out how to make this make sense. It's kind of like almost like a puzzle. It feels exciting and gets at least me engaged in kind of a different way, which I think is nice also.
Yeah.
Because, yeah, play therapy just can be a lot and is definitely one way of kind of using your mind. So, yeah, this is pretty different.
No, I think it makes a lot of sense. And it requires a lot of thought.
Mhm.
And so you have to really understand the theory, and then you have to really understand, like, if it's like the diagnosis or a presenting concern of anxiety, which is what we're talking about. And then you
Mhm.
have to figure out how to match those two. And then add on to how to say it in a way that makes sense for the people that you're talking to. And so it's a very unique, individualized thing, because for each person you're going to need to adapt as to how you engage. And so I'm kind of curious, like, when you have someone calling in like for the first session and they're saying my kid's really anxious, like, how do you share that information with parents as to why you think CCPT is a really good fit?
Mhm. Well, the first thing that came to mind, and so I'll answer your question in a minute, but as you were asking that was, I think a lot of play therapists feel a need to quickly give the parents strategies.
Mm-hmm.
Because a lot of times when the kids are anxious and that's what they're coming to play therapy for, the parents are pretty anxious too. Whether that's because there's like a hereditary link between anxious children and anxious parents, whether it's
Apples fall from apple trees.
yes. So the parent might already be fairly predisposed as well to having anxiety, or they're just like, my kid's not themselves anymore. And like, I want to fix this because the parent cares about their child. So I think that there's this almost like desperation that parents will oftentimes bring to that first parent consultation, specifically with anxious children. And so I think it's easy to quickly say, oh, well, here, you could just do this. And this will help with bedtime or help get them from the car into school if that's how they get to school, or help get them from your house to the bus stop, or whatever needs to happen to try to help with those behaviors that they're struggling with. So I think first, kind of realizing like that's not what's needed here. That's not necessarily going to be the most helpful thing for what the child is needing. But then I think going through and talking about how, and I kind of talked about this last time we talked about realizing that in CCPT, what you're doing is that you're forming a relationship, which kids feel more secure and safe in relationships. That, we're not really meant to do it alone. And so that first of all, just inherently can be helpful, and that you're going to really be focusing on creating a lot of stability and safety within that relationship and within the play therapy experience, so that then kids can start really processing through what that anxiety is about for them and start developing different ways to approach those feelings when they arise. And so I kind of walk them through it. I don't get into a lot of the technical details about like, oh, well, your child then is experiencing incongruence in this way, and they must have conditions of worth that are getting them away from their organismic valuing process and not helping them be self-actualized, right? Like you're not going to talk about it in that way, even though that's what you're doing with children, but just talking about it in ways that parents can understand. This also sometimes can sound more behavioral in nature, which I think that also throws off child-centered play therapists sometimes, of like, well, I can't talk about it in that way because that's not what I'm doing. And it's like, yeah, okay, so you're creating the safety, you're creating the relationship, but in doing that, children will start developing alternate coping strategies. So I'm not going to ever go into session and be like, let's talk about coping strategies, whereas you might in a different modality of working, but kids figure it out. And so I can talk to the parents about this will likely be a part of the process. Even though that's not going to be what I'm doing explicitly or concretely in the room with the child. So that's typically what it looks like, is kind of taking what I'm hearing from the parents and talking about, well, yeah, I think that they're a great candidate for play therapy. This is kind of what I'll be doing. And I'll also be working with you too to try to figure out different ways to make these things at home better for you all.
Yeah. Well, and I think it's important, and Christy does a really good job of reminding me of this too, is like, yeah, we're not necessarily teaching things, right? But that doesn't mean that they're not like learning or developing them for themselves. That through limit setting, through reflection of feeling, reflection of content, like returning responsibility, all of those skills that we use are helping kids in that moment experientially and in real time practice or explore or develop and within that safety. And then once they feel secure in that, then it's easier to go try it in new spaces. And so, yes, we're not going in and like teaching coping skills. We're allowing them the opportunity to try out coping skills.
And find the ones that are going to work best for them. Because I mean, you can Google right now and say like, okay, coping skills for anxiety, and you can get like 50 things or something, like that.
Yeah.
And so, but parents aren't doing that. Well, some are, but if they're in your office, they're not necessarily doing that.
Maybe it didn't work.
And so, yes. And so, that's the kid could figure out what works for them through this process. And I think that that's also really amazing, because that'll work better. If we tell a child how they should cope, it might work, if you like throw enough things against the wall, something will stick. But this way, what they actually kind of figure out for themselves will likely be more effective in the long term.
Sorry, Christy, did you have something?
No, I was just going to say, and sometimes it's not the first time you do something that it works. You have to practice it a few times. And I think right now, we have so much information at our fingertips. And for some parents that I've worked with, if it doesn't work instantly, they're already throwing it out without like letting it settle for a minute. And it's like, okay, talk to me how it went, instead of let's jump to something new. Right? It may just be this is so new that your child isn't even able to hear what you're offering, or like getting a real chance to experience, like whatever it is the parent is trying. But it is hard because there's so many resources online. And sometimes it's also taking parents, like, take a step back. Okay, well, how did they respond? Right. And it sounds like maybe a piece of that stuck. Let's talk about that before we jump to something else. Because I
Mhm.
also just wonder if the constant influx is also what overwhelms kids so much and almost reiterates that sense that something's really wrong with me, or like I'm so
Mhm.
hard to figure out or something like that.
Mhm.
We just keep throwing things at kids instead of like
Mhm.
being really consistent, or
Yeah.
again, I keep going back to that word predictable, but that's really what helps provide safety for so many kids.
Mhm.
And they may
Yeah.
or may not be getting that.
And I think it makes
Mhm.
sense for parents too, right? Like I just like as an adult, like I remember in grad school, they were like, well, you need to be do well-being or whatever, wellness. And they're like, go do yoga. And I'm like, I really hate yoga. Like
Mhm.
we talked before, I'm very competitive. I want to know that I can do these moves more better than the other people. Like that's not helpful. And so I think sometimes like when we remember that for adults, it's not helpful for someone to come in and tell us how we can be less stressed. It kind of
Mhm.
helps us remember that maybe that's not helpful for kids either.
Yes, definitely. And I think that also, when thinking about the consistency piece, anytime I'm making a recommendation to a parent about a different way to be with their child, I tell them it's probably not going to work for a little while. Like I set up that expectation because I found that when I didn't, and I'm like, just go do this, then there is this like, oh, when I do this, this will change automatically. And that's not the real world. And so I already set up that expectation of, it's probably not going to work right away. And so I want you to do this for the next 2 weeks, and then we'll touch base. And this is all that I want you to do. And so what I would expect might happen, and this is, you have to kind of know the child to be able to say that, is that it might look like this and this and this. Do you think you can handle that? To also look at what the parent's capacity could be for what that shift might be, so that you can assess, like, will the parent actually be successful? That was also something that I used to do a long time ago, is make all these recommendations that parents never did because they weren't good recommendations, and they weren't really going to be feasible or fit into their lives. Even they might have been fine recommendations from like, oh yes, this would be helpful. I'm sitting here in my chair saying that kind of thing, rather than what's actually feasible, or the parent has the capacity to do just based on kind of their own emotional availability. And so, really encouraging, things that actually hopefully can happen, but then letting the parent know what to expect, and that we'll talk about it and we'll troubleshoot based on how it goes. That I think that parents a lot of times feel less anxious if they know that this is kind of the outcome, or what I'm expecting to happen from it. Like that's been really helpful. Again, with kind of anxious kids, anxious parents, working with them through that and providing that consistency, hopefully for the children, but also this kind of predictability for the parents too, that helps them be more willing to try.
So, in you saying that, Haley, it makes me think that maybe you're following up with parents, or in particular with parents that you've just given some feedback to or some support to, maybe not every 4 to 6 weeks, but you may be following up a little quicker with an anxious parent than you are with, like what we read in the books, that you should
Mhm.
meet with parents every four, ideally every
Mhm.
4 to 5 sessions.
Yes. So for some, yes, I definitely meet more frequently. It depends on the level of distress for the child and the parent. If they are needing things to change faster, because that's a reality sometimes. Whether it's, the child needs to get on a plane and the child is terrified to get on a plane or get a shot or something, or like they're going to sleepaway camp or whatever it might be that might necessitate kind of a faster process. I find that working with the parents more frequently can help, because they can be implementing things at home that can hopefully help provide more kind of stability, consistency, safety, security for the child, even if I'm still just meeting with the child weekly during that time. But also, if I think that a parent can't really maintain trying out a skill for 4 weeks because that's a long time to try something out, especially if it's not working, then we might not schedule a full parent consultation after that. It might be a 15-minute phone call that we do just to check in and say, hey, how has it been going when we've been talking about limit setting in this way? Did you try it? How'd it go? What did that look like? What were the situations that came up, and kind of processing with them and then saying, okay, it seems like things are starting to shift. I want you to keep doing that. And when we meet for our full parent consultation next time in 2 weeks, then we can really kind of break it all down and see where things are in kind of a larger scale. And so doing things that way can be really helpful. So, I mean, there's some flexibility. I would not go more than the stated 4 to 6 weeks with these kids and these parents. So, yeah.
I have another question for you. Have you been the first to like broach the idea that the kid has anxiety, or is it always the parent telling you the kid has anxiety? And then what would that conversation look like if you're the one broaching it?
Sure. So I would say it's about 50-50 on kids who are parents are saying my kid has anxiety, and me saying like, I think your kid is anxious. And so I'm throwing that out there. So for the parents who are bringing it to me, some of them are pretty definitive and like, I know my kid is anxious. This is what's happening. And some are like, other people are telling me my kid is anxious, but I don't really know. And it's kind of that conversation. And so those feel a little bit different because the seed's already planted. And so they're already kind of open to that in some capacity that that's what's going on for the child. But for when parents are just saying, well, they just won't stay in their bed at night and it's driving me nuts. Nobody's getting sleep. And apparently play therapy can help. So like do this. And I start working with it. I'm like, okay, I'm already thinking, right, that there's probably some sort of anxiety going on if that's what's going on, like if that's the presenting concern and the behaviors that are happening for this child. But then I start meeting with the kids. If I'm noticing these kind of anxious behaviors in session, then I do talk to the parents. I always like to check in, how have things been going since the last time we met and kind of seeing. But then as I'm talking about things, I'll say, I'm noticing that your child's spending a lot of time organizing things in the playroom, which to me can be a sign that they might be feeling anxious, that they're working really hard to make sure that things are exactly how they need to be. And kids who tend to be that kind of controlled in how they're playing tend to feel anxious. How does that fit for you? What do you think about that as an explanation for what might be happening for your child? And being really tentative in language, I think helps. Thankfully, in some ways, anxiety is not this big, bad, scary thing. For a lot of parents, it seems like it's pretty kind of mainstream almost. And so I haven't had a lot of parents react really negatively, but I think always when we're presenting something to parents, I think you should be kind of tentative first before you see if that fits for them, because they know their child really differently from you. And then if they're like, oh yeah, that does make a lot of sense. And I wonder if that might be why they're waking up in the middle of the night. And you're like, yes, there we go. That's it. We probably are figuring that out. And it might be like, no, that doesn't fit. And then, that's up to kind of you and your clinical judgment of seeing like, is this really what you think is happening? Or could there be something else? And you as a clinician, I think, have to be really open to the possibility that that might not be it. Like the parent might not be aware, might not understand, or might not be willing to accept that, but also there might be something else going on for the child that you weren't thinking of or didn't see yet.
I've had kind of this like divide of like kiddos getting diagnosed with ADHD or first getting the term ADHD, but it looks more like anxiety in the playroom to me. And I
Yeah.
don't know if it sounds like that comes up for you as well. And like,
Yes.
and sometimes I think, I don't know, ADHD maybe feels like not safer, but
Mhm.
like maybe more acceptable. I don't know, but but it's hard to like kind of navigate parents away from that diagnosis over maybe this could be anxiety. And then I also
Mhm.
find that if I send them for psychological testing, that the minute they say ADHD, they often come back with an ADHD diagnosis, even if clinic, and they don't ask me for my opinion as
Mhm.
the clinician who's providing weekly services. Like, I'm not seeing that as much as I'm seeing this. And so it sounds like you get those same types of things. So I'm
Mhm.
curious,
Question
peer to
is for me.
peer.
As the
Well,
mom of someone, I'm like, is it ADHD or is it anxiety? Is it
yeah.
both? I don't know.
And
Yes.
it could be both, right? Like, I'm not saying it's
Yeah.
not both, but it,
Yeah.
it is hard to kind of navigate. And I'd love some just of your thoughts on like walking through that with
Yeah.
clients and uh, parents in particular.
Mhm. Well, it does seem like ADHD is kind of like the gateway diagnosis for others. Like I do think that there is something to that. I think that that is kind of more easily identifiable and diagnosed since it is so much more behaviorally based. A lot of kids who receive that diagnosis have pretty clear disruptions, like in the school environment and things like that. It makes it easy. And I think there is a lot of awareness and advocacy for kids who meet the criteria for ADHD. And so I think that it's becoming so prevalent. Like I'm trying to remember the last time that I feel like I had a kid who came to play therapy who did not have that diagnosis, or the parent wasn't exploring that in some way. I think that in some ways that's almost like the go-to. And I think like TikTok has a role in that. I think there's so many things that are influencing that are making it like, oh yes, all of these behaviors must be ADHD. And then, yes, I think once that's mentioned for somebody who might be providing some sort of evaluation, I think it tends to come up. That feels like a kind of chicken or the egg situation to me about that. But anyway, but I think when I'm talking to parents with that, for me, when I'm thinking about diagnosis and maybe trying to change their minds, it's about why do I want to do that? And so, like, what's useful about this child having an ADHD diagnosis versus an anxiety diagnosis? And what will that actually like mean to the family and to that child, to the parents? Do they qualify for different services and would that be useful? Would they put them on different medications? And is that important? I mean, to me, that seems very important if they're trying to medicate for possibly the wrong thing. But is it just so that they're identifying in this way? Is that as important to change their mind about what this looks like? And it could be yes, because now the child is identifying with ADHD as opposed to anxiety. And like that might influence how they view themselves or what, their kind of life trajectory is, right? Like there's a lot of different things I think to consider as far as how much to, or like when I would maybe really push and advocate for a shift versus not, if the parent doesn't seem receptive. So I think that is part of our responsibility as clinicians. If you are diagnosing, you're kind of looking at that to be communicating that with parents, that is part of your practice and what you're doing. And so I think that that's important from that perspective. But if you're doing it for other reasons, to just be really clear about what those are and what the implications are going to be for the child in that family.
Yeah. No, those are really good points. Thanks.
Yeah.
I'm trying to think if I have any other questions. I think like you've covered a lot of it. I feel like, having the conversations after they've been in therapy for a while, like how do you help like connect the dots between what they're doing in the room and like what they're seeing at home and like how it might align? I think about like, I don't know if you guys seen the meme where they're like, we played The Floor is Lava for 45 minutes and then like the note is like navigated like existential crises and like improved on self-concept and blah blah blah. But I'm just kind of curious.
Yeah. And so I think it's, not thinking about just the individual behaviors that the child is doing in session, but thinking about like, what is that experience like for the child and kind of what's the why behind it for them, and communicating that. And so with anxiety, like we talked in the last episode about like different behaviors that show up. So whether it's like aggressive types of behaviors or asking about the time or lots of organizing or cleaning or self-soothing behaviors, of if you are conceptualizing this child when you're going through your theoretical conceptualization and your understanding of them kind of holistically based on what the parent is saying and what, all the information sources, and you're taking that all into account, and you're seeing that as anxiety of then kind of understanding, okay, they're destroying my whole playroom because they feel so chaotic and disorganized and they're feeling so anxious. And so instead of communicating to the parent, they're just destroying my playroom every week. I really hate this. And I'll just spend 30 minutes cleaning up after it, right? Like you're not sharing that, but sharing more of, it seems like your child has a lot of chaos that they're feeling internally, and that they're feeling a lot of anxiety and just don't know what to do with it. And so it's coming out really wonky. And so, yeah, that's why they keep getting sent to the administrative office at your child's school, because that's what's happening for them all day long, is that they're trying to hold it together. And then a kid looks at them like with side eye, and then that's it. And it blows them up. And so, in play therapy, we are really working on regulating in those moments of like allowing your child to express themselves and kind of get it out and get that release. And I'm definitely seeing them working through that. But it also does really seem like things are just very chaotic for them internally. And so, kind of giving that spiel. And then the nice thing is that then we can talk about, and like I've, hopefully already thought through this of like, okay, well, so if this is what's going on for the child, what can the parent do to try to make the child's internal world less chaotic at home? So that I can give the parent something that they can do that's actionable, that's connected to what we're doing in session. And it's kind of like, okay, now you have your work and I'm going to keep doing what I'm doing in session to help them regulate in this way. And together that will hopefully help improve what's been going on and help the child feel less chaotic. I mean, that's just one example, but you can do that with all the different things that are happening with kids in the playroom once you conceptualize, I think, fairly easily in that way.
Yeah, no, I think it's really helpful. And it's an example too that maybe doesn't traditionally look like something you would expect from anxiety. Mm-hmm. So I think that's where it's really helpful also, is that like you're really having to think about these things and being purposeful and intentional in how you are working to understand, and that you have to take everything into perspective, right? How they're mm-hmm. experiencing like school, what's happening at home, what's happening in the playroom, and like taking all of this information and putting it in to understand through that lens, I think is important.
Mm-hmm. Yeah.
Yeah. Well, I'm not sure if I have any more questions.
Sure. Hayley, I think this has been so helpful.
Yeah.
I think
very helpful.
It's such a common thing that I think play therapists will see in their playrooms. And so having these discussions mm-hmm. around, anxiety and really like understanding the roots of it, but then also like, how do we convey what we're seeing, and helping parents also along the way is such an important component of the jobs that we do as play therapists.
Mm-hmm. Yeah.
So thank you for sharing your wisdom.
Of course. Thank you for having me. I love talking about anxiety, so I'm here for it whenever you want. No,
no, it's great. But it's just nice. We're really lucky, I think, to be able to call on so many experts. And so we really appreciate like your willingness to share your time and your expertise with us. And I hope that it's helpful for our listeners. So yeah. Well, thank you.
For everyone out there. Yep. I'll do the ending spiel. Thanks for listening. Don't forget to like and subscribe. Follow us on all the social media platforms. And then if you want to communicate us, you can always comment below in the podcasting format that you are listening with, or you can email us at playtherapyspace.com. Or info@playtherapyspace.com, or Christy@playtherapyspace.com, or Maggie@playtherapyspace.com.
Yeah. Thanks, guys.
Thanks. Stay warm this winter.
Ugh.
I know.
So over
Thanks, it. Hayley.
Thank you.
I'm glad you're warming up there in in Texas.
Thank you. Yes, me too. Oh.
Yeah, the East Coast hopefully is not far behind, but yeah.
Yeah, I know. I hope you guys get some better weather. Oof.
It's okay. It's January, February on the East Coast. I think it's pretty norm.
It's expected. Yes. Yeah, you chose that life. Sorry.
Yeah, right.
Not for empathy right there. Like
as I just like start crying after day 6 of no school. Yeah.
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 I chose this. I chose it. Well, thank you, Hayley. I appreciate you.
Yeah, of course. Hopefully that was what you all